audience. Loveline may contain sexually oriented content. Listener discretion is advised. 2, 1, go. Adam Carolla and Dr. Drew. Loveline, coast to coast.
Yep, it is Loveline. I'm Adam Carolla. That's Dr. Drew over there. Phone number 1-800-LOVE-191. Fax number 310-854-4455. Dr. Drew is a board-certified physician and addiction medicine specialist. And before we introduce our guest tonight, I wanted to say something, Drew. I don't know if I brought this up last week or not, but it did strike me as funny. Remember the rioting that was going on in Quebec when Bush was over there for some sort of economic summit last week at some point? I was really delighted by the reports from the news that they were throwing bottles and bricks and hockey pucks. And I thought, wow, talk about really nailing a stereotype. A bunch of people, a bunch of Canucks chucking hockey pucks.
Beer bottles and hockey pucks.
Yep, and they're throwing like
Moosehead beer.
Maybe Labatt's Blue and hockey pucks. And I was watching the news, and it probably wasn't a good time for me, but I thought, yes, I'm right in every stereotype. This is exactly why I stand fervently by my stereotypes, because they were throwing hockey pucks, and that wouldn't have happened in any other region of the world. But Quebec. Am I right?
Yeah.
There you go, everybody. That's what stereotypes are. They're there to help.
Let's put it this way. They're meeting in Tucson.
Yeah.
Will there be one hockey puck in Tucson, let alone thrown by Tucsonians?
That's the thing. And you see, people don't like stereotypes. First off, they say negative stereotype. Not all stereotypes are negative.
Most have some comedy in them.
I would like to see a hockey puck thrown at our next outbreak here
in
Los Angeles.
Yeah.
I would smile from ear to ear. And you know what else is good about stereotypes? It helps you put things in a context. Like if you just hear them throwing hockey pucks, you're like, holy Christ, what is this? Well, you'd think there was some sort of
ritualistic behavior. It meant something. What the hell's going on? You wouldn't
know, but you hear it's in Quebec, and you go, oh, yes.
You have extra
yes, the Canucks are throwing pucks. Dr. Bob Schwartz is our guest tonight. Dr. Bob is the nation's foremost sex therapist and educator. He's the author of The 1 Hour Orgasm. And I think Drew and I land on about the same spot on this one, which is we do know there's better sex out there. We're just not willing to look or put any time in. Is that where most guys are?
Yeah. About 50% of guys are interested in improving their sexual skills, and about 50% could care less. It's not because they don't want to satisfy a woman. It's because
they're lazy.
Yeah, they're lazy, and they think they already know everything there is to know. But when I named the book that, most guys thought I was including dinner in the title. You know, I mean, how do you go from 10 seconds, which is like a typical orgasm, up to an hour?
And this is the woman's 1 hour orgasm.
Actually, it's for both.
Really?
But it's a good question.
We get to watch them for an hour? Is that what you mean?
No. A man can have one too. Although most men think that if that were to happen to them, they'd become dehydrated and have a heart attack. But it's only because we think of orgasm in male terms. And the male's orgasm is thought of as the ejaculation of sperm. But if that were true, women would never have them.
Let me chime in for a second here, just because I know we're on radio and our audience at home is curious what Dr. Bob Schwartz looks like. Drew, stop me if I'm wrong. He's sort of a version of the crazy juice guy who's on late night television. The crazy guy with the wild eyebrows who talks very passionately about juicing, constantly juicing. He's this sort of even more virile, more robust version of that guy, if that's possible.
Thank you.
You look like you take some anti-aging hormones and work out all the time. Is it? Yeah?
Well, I used to own a chain of health clubs, so
that's what I was getting from you.
Difference, yeah.
Yeah. So let me ask you. I got a million questions for you, but this one just popped in my head. Where do you come down? And by the way, is this just my earphones that sound bad, or is
no,
it's just me?
Yeah.
Everything else sounds good. All right. Sexual surrogates. Did you ever use them?
No.
Did you ever recommend them to patients or that sort of thing?
No.
Do you believe in them? It always seems a little dicey to me.
I can see that it could be a shortcut for some people. But for most people out there, that's not something they're ever going to do.
All right.
And you have to really trust the person that you're putting your sexual nervous system into their hands, so to speak.
Right. And what changing gears here, what is, how does one achieve the 1 hour orgasm? I mean, how is this physically possible?
You keep the orgasmic contractions going, which last for about 0.8 of a second each, for as long as an hour. The longest they ever did it was 11 hours at the university where this came from, Moore University up in Northern California.
Oh, Northern California. Yeah. Shocking.
But another California thing.
And how do you monitor that? I mean, how do you tally that?
They have skin galvanometers and things to measure your pulse and your breathing and your heart rate, and they can see the contractions. You can actually see and feel the orgasmic contractions happening in the person. Now, you could fake a certain number of contractions, but you can't fake them for an hour or 11 hours.
And what is I'm just sort of thinking realistically, what are we going to achieve tonight? Because our idiot listeners aren't going to do the 1 hour. They're not going to do a bunch of exercises with their pelvic muscles and stuff. But maybe we can get to some basic answers.
Yeah, right.
Like a lot of guys call this show every week talking about premature ejaculation.
Yes.
And they want to know how to slow it down.
Yes.
And we have a couple of answers we give them, which is, take care of yourself an hour before your girlfriend comes over, or, put the Hey Vern guy poster up and stare at that. I mean, but we never really come up with an answer that satisfies them or us.
Good,
do we,
good,
Drew?
Good.
Other than just trying to give them a general direction to master their own sexuality, they're afraid to sort of masturbate. They're afraid to do things that might help them sort of be prepared for the actual encounter.
Yeah, but Dr. Bob, what do you think?
No, a lot of guys out there have this problem, and it's a complaint for a lot of women. To use a sports analogy, the women complain that the guy winds up in the showers and she hadn't even gotten to the stadium yet.
Right.
And 70% of women, after the honeymoon period, during the honeymoon period, women seem to do fairly well. But after that initial newness of the relationship wears off, about 70% of women say that they're not having orgasms every time, but the men continue to. So that creates an imbalance in the relationship.
Well, what's some easy tricks, if there is any, for a guy to slow it down?
Two things you can do. You can do what we call sexercises. You go to the gym and work out your body.
Right.
This is a lot more fun. And it strengthens your sensual nervous system. And it also helps you become aware of the levels of intensity. As guys, we know that if you get to that certain level, it's like a freight train. There's no stopping.
Right.
But prior to that, you can actually either slow down or stop.
Right.
And let the sensations drop down a little bit till you get back in control.
Well, I think it's a good point, because I think what a lot of people do is they get right up to that point, and then they try to stop it at that point.
Yes.
And at that point, it is a freight train where the brakes went out. But you're saying don't get to that point so fast.
You can learn to actually become aware of the distinctions of where your own body is. Now, that's okay to do, but the most fun way to do it is to have a personal trainer, which is usually your wife or your lady friend, do it for you. And we call the technique the Venus butterfly, which
how does that work?
Before.
Yeah, but I don't know what it is.
Well, basically, it's three things. It's when, where, and how. The when is first getting your partner in the mood.
Right.
And with a guy, that's very important. You have to get him in the mood, erect, before you start. Two is the where on his body are the most nerve endings located. And on a man, it's usually the end of his sexual organ, where the most nerve endings are. And the how is what kind of pressure and speed to use to create the most intense sensations in him for the longest period of time. So what the woman does is she actually learns manually how to do this first, and then she can do it
Manually with her
hands.
Manually
yes.
or
with her hands, yeah. And then she can do it, orally or even through intercourse once she learns the exact kind of pressure and speed that feels the best to him. And she
but he's having no difficulties with his
our problem is
orgasm.
that at the moment of penetration, they're orgasming.
I got it. Okay, so he's getting too excited.
Yeah.
Now that's
without any touching at all. These guys are having, right? Some of these guys say they take their pants down and pow.
Here's what it's like. We'll do a little reenactment. Hey, lift your skirt up, would you?
Here goes. Here.
Thanks, baby. Hand me the remote.
In my experience, that's rare. But that's a sort of a acknowledgement to the woman's attractiveness. He gets so... I can't...
It's a great compliment, but it's right up there with, I love you too much to ever be away from you. Right. I have to kill you, too. It's like fantastic.
Well, there's the whole attachment theory now is evolving sort of the theoretical framework for how the autonomic nervous system is structured around attachment and connection with other people. And people that have these sympathetic dominated systems who are over-aroused and over-intruded upon in early infancy tend to be the ones that have, there's all sorts of psychological profiles that go along with that, but they're actually wired differently. And so because of their parasympathetic system isn't the tone isn't high enough to prevent the orgasm, they're just there all the time and pow, little stimulation, ejaculation.
Now here's where
the serotonin reuptake inhibitors prevent that.
All right, hold on a second, you two. You're Drew. It was good until you started talking.
All right, I'll stay on.
Really, we gotta work you out of this show.
All right, don't worry.
Hold on a second. We got to take some phone calls, but we're here with Dr. Bob Schwartz, by the way, who we'll just call a sex expert for lack of a longer title. Marcy.
Yes.
You're 25.
Yes.
What's up?
Adam, Drew,
Yeah.
I have a question. Is there any long-term side effects of using a vibrator?
This Dr. Schwartz can answer this.
Well, one, it's better than what most men can accomplish, but a sexually trained man can outperform a vibrator. Now, if you use a vibrator for a long period of time and you use the real heavy-duty ones, you can numb those nerve endings. But it's not permanent. It's like a cut. Your body can heal the numbed nerve endings if you stop using it.
So they will sort of desensitize.
Yes, and then you'll have even most of the time more problems with actual human contact because
it's not good enough.
It's not intense enough for you because you're used to all this heavy intensity, and yet the intensity can only take you so far. Where if you have someone that knows what they're doing, they can actually give you more intense orgasmic contractions, and they can keep them going for a longer period of time, rather than having what we call a genital sneeze. Right. It's not that those sneezes are bad; they're actually a lot of fun, but there's so much more available that you're missing out on.
Hey, Marcy.
Yes.
How often do you use your vibrator?
Oh, at least 3 times a day.
Oh boy.
Yeah. You use a Duracell in there?
Energizer. They keep going and going.
Yeah.
And
are you doing something else here too?
No.
No drugs or alcohol involved here?
No.
Do you have a history of that kind of thing?
No.
Your family history of that?
No.
All right. She just likes her vibrator.
I was wondering, because I would like to have children one day, and at times I do feel guilty for using one.
No,
I didn't
ridiculous.
know if using one would, decrease my chances of...
No, you're fine.
No.
You don't have a partner, do you?
Pardon me?
You do not have a partner, do you?
Yes, sir. I do have a partner. He's... How can I put this?
In jail?
Is it hanging out at the Rock and Roll Museum?
No. He just doesn't go the distance.
Does he orgasm too quickly?
I just can't describe it. When we first met...
Hold on. Is this me or does this Marcy sound like Captain Kirk? Hey, fuck! It's like, are you on the toilet?
No, I'm just
All right, well, spit it out, baby.
I'm just
Jesus
nervous.
Christ.
I'm just nervous. I'm sorry. It's
All right.
when we first met, it was great, but
this is what Dr. Schwartz was just saying. That
right, honeymoon's over.
Yeah, honeymoon's over. Now...
okay, let me explain something about guys, and you girls better hear this.
Yeah.
They're like children. Now, here's
school children.
Well, here's the way children are. They will spin out until you reel them in. I mean, they'll take as much line as you give them.
Well,
your average kid?
When you say, well, let's put it more specific, like an 11-year-old with a new job. Would you say? Like, at first, they'll do the job well, right? They do the job exceedingly well.
No.
New broom sweeps clean.
Yeah.
And then they start pressing limits.
I don't want to use denial in the show at all, but no, that's not what it's about. No, that's about half of what I was saying. What I mean is kids need boundaries and they need limits. And forget about the job. Just a 4-year-old, they'll spin out as far as you let them spin out. And that's what happens to men. They hold down jobs. They're responsible guys. They play by the rules. But in the relationship, they'll start checking out. And they'll just start like a boat, just drifting away from the dock. They'll just keep going. You got to be that rope that moors it to the dock. Yeah. And women, you got to pull them back in. Tell them what you need. Tell them what you want, and tell them what they have to do. And most guys will respond to it.
I agree with that.
Yeah. I think one of the things that most guys don't realize is the same skills that you had during that honeymoon period don't usually hold up later on in the relationship. When I'm talking to guys that have been in a relationship for a long period of time, they all pretty much say the same thing. The longer I'm with her, the longer it takes me to get her in the mood, and the longer it takes me to gratify her. And after a while, sometimes doing the best they know how with their old skills, they give up.
They're not even doing that, though. Not our listeners. No, they get into a groove, and it gets easy. Christy?
Yes?
You're 19. It's like this radio show. Drew, remember I used to get here about 9 o'clock?
Oh, yeah, and you used to be awake.
Reading bios.
And sober.
Looking at email. Now I roll in drunk at 30 seconds to 10.
Yeah.
And I'm surly when I sit down. Christy?
No, yes.
Yeah, that's all you need to know about guys. You're 19. What's up?
I needed to ask, is it normal, when me and my boyfriend have sex, it takes hours and hours, for me to have an orgasm.
Hours and hours?
Yes. But
God bless him for hanging in there.
Well, but sometimes at night, I'll wake up in the middle of having an orgasm. It doesn't even have to be a night that we've done anything. I have them in the middle of the night.
Mm-hmm. While you're asleep?
Yes.
So what you're asking is why would it happen so easily in sleep, but have such difficulty when you're...
Right.
Yeah, well, for women, it's such an emotional thing that they can be brought to that place in their sleep. It's not about being manipulated physically. I mean, don't stop me if I'm wrong, Dad.
Guys have wet dreams also. Guys have orgasms while they're asleep also.
All right, but they're raping the poodle in their sleep.
Right, at Grandpa's funeral.
In their sleep.
Oh, no. Well, when you're,
no, in the dream, Adam, in the dream, okay?
Yeah, okay,
but when you're asleep, see, there's no, I think you just hit it on the head. There's no pressure on you in the dream to perform. Mm-hmm. Orgasms are like fame and fortune. When chased directly, they become very elusive. One of the things that I recommend you concentrate on is the pleasure in the moment. Enjoy every stroke, every amount of pleasure you can, and don't worry about where it's taking you. And if you enjoy what you're feeling enough and focus on that, orgasms come by themselves. But if you try to force them, then it's going to get harder. And a lot of times you'll notice a guy, when he starts out, he's really feeling what's going on. You're really connected. And then you feel him shift gears, and he starts driving for your orgasm. And that, women usually do one of two things at that point. They either try to help him, or they just go the heck with it and give up.
Who's on Tonight Show tonight?
Yes.
And for women, it like I said, it's such an emotional experience, their orgasm, that the minute they start losing their focus and trying to be concerned about the guy and help him along and worry about him, it's probably over for them.
Did I tell you about this experience with Christina Ferrari and these white truffles she had? I talked about this?
No.
I'm convinced that oxytocin...
She put them in her?
No, it didn't go in her. And by the way, these white truffles are like a Dr. Seuss food. They have truffle-finding pigs.
Yes.
That find, I thought, oh my God, that's something Dr. Seuss would dream up.
Truffles are the weird mushroom type things, right? They get them in like Scotland or England or something. We
were doing a show on foods that cause arousal, and I believe oxytocin is a big, big thing for women. And she smelled this stuff that basically smells like placenta to me. That's really what it smells like. And she goes, oh my God, my uterus is contracting, my breast contracting, it makes me have this arousal. And I thought, that's all oxytocin, all this stuff. And so I wonder the extent to which men need to pay attention to those experiences that allow women to have those kinds of connected bonding experiences that allow that hormone to flow.
Well, she is a very highly, what we call Temess woman. I mean, you walk in the room with her, and it's not that she's directing
Christina
it
Ferrari?
Yeah, she's
horny.
She's not that she's directing it at you. She is just a very highly sexed lady. And I was really surprised to hear when she was having some problems.
Did you do her, Bob?
No.
Seriously?
I think
Off the air, you tell
she's
me.
very faithful to her husband. That's not a problem.
You're a
That's
doctor.
never an
That's
issue.
Not cheating. You're a sex doctor.
I didn't know that was in the rule book. Nobody told me that.
Her husband's a great guy, too.
Yeah, he is. But they're what we call tumescence. We never had a word for it before, and it's borrowed from the medical community. It means be swollen with energy, in this case sexual energy. But there are these waves of energy for all women that come in twice a month, one right before their period, and the other one, this slightly smaller but still powerful, right before their ovulation cycle. And then there's this giant wave that comes in every year around this time, spring.
Oh, how interesting.
And if you're aware of these tumescent rises and fall of energy, you'll notice that usually during the time of month that it's the highest, you have your biggest fights or your greatest lovemaking. You really have a choice with how you use that energy, either for pleasure or for mischief. So learning how to control that tumescent energy or build it up if it's too low, or in her case, bring it down if it's too high, is a great gift for a guy to have.
You say that they have this during spring. So do you think
they're going to rut, basically?
Was there mating? There was a mating season for human beings
all
millions
mammals.
And millions years
all
ago.
Mammals.
The female humans in rut.
Interesting.
And you'll notice spring cleaning, moving the furniture around.
I got
all
energy.
This is,
Nesting.
Yeah. All right. Well, you heard it, fellas. The dinner bell's ringing. If you can't get laid in April, you can't get laid, right? So that's April, May. That's through. That's until when?
Now,
Middle of June.
Interesting point. Did the birth control pill take that away?
That's interesting. That might interfere with the natural cycles. Yeah.
Because there's a biological anthropologist that's theorizing about this.
Wow.
Lionel Tiger.
And lately, with the 30 million women losing their sex drive out there, that's something they used to not talk about much until the 60s.
All right, we got a lot of questions to ponder tonight. Dr. Bob Schwartz is here. He's the nation's foremost sex therapist and educator. The 1 Hour Orgasm, thank you, Drew, is the name of the book. Where are you going, Drew?
I got a phone call.
Can't wait till commercial, huh? All right, you got to actually pick the phone up while I'm talking into the mic. Just about to go out here, there, Drew. Just wrapping it right up here. All right, we'll be back after this. It's Loveline. I'm Adam Carolla. That is Dr. Drew over there. Phone number 1-800-LOVE-191. Dr. Bob Schwartz is our guest tonight. He's the nation's foremost sex therapist and educator. He's the author of the 1 Hour Orgasm, which has made the Times best-selling list. And basically, you'll recognize the book when you see the picture of the chick who's having the orgasm on the cover.
I don't know if you saw on HBO in February, they actually featured my wife and I in the book, and they let us do our course on their Best of Real Sex series.
Yeah, I have seen, I don't think I saw that episode, but I am familiar with the series. I have masturbated to that series many times.
And it was cool.
Many times.
We didn't get to use the book because for most guys, they don't like to read as much as they like to look at pictures. But they let us use our videos, so we would show the men the video that we made for the men on how to do this Venus butterfly technique to the woman, and then my wife would show the women how to do the Venus butterfly technique to the men, and then we sent them home that night to do their homework, and then they came back the next morning and talked about the results.
How humiliated are your kids, by the way? Tad's running around with his jack-off theory. My God. Have they changed your names? Or?
Yeah, well, you know, if you don't talk to your children, between the ages of 8 and 12, you lose them forever to your peers. I've heard you say that, and that just hit the nail on the head, because I lost mine a long time ago.
I knew it. but I knew somehow they were somewhere going, oh, Christ, Dad. Oh, no. Hey, didn't I see your dad on that Real Sex thing? Yeah, he was boinking this chick. He used a cucumber. I don't know. You guys look alike, though, I'll tell you that. All right, let's talk to Sarah, who's 19 years old. Sarah?
Hi, Adam and Drew.
Yes, Sarah.
Say hi to Dr. Bob Schwartz, too.
Hi, Dr. Bob.
Hi, Sarah. What's going on there?
Well, I have a friend who I've known for about 6 years, and we ended up going to college in the same state. And she is now having a relationship with her coach.
Are you guys at Yale? Where are you?
Pardon? I'd prefer not to say.
There's not too many schools in New Haven, are there? Okay.
Yeah, that's true. But anyways, yes, so she's in a relationship with her coach. And
At college?
Correct. And it's violating, a lot of school regulations.
Right.
Is her coach a guy or a girl?
I don't know.
Oh, interesting. You don't know? How is it you don't know?
Oh, she knows. Of course she knows.
I'm too scared to say.
It's a girl, of course. It's a female coach, and you're into her, and you don't like this. Oh, yes. Oh, yes.
No, sorry, Adam.
No, I don't get that from her.
Excuse me, but yes. You don't get that?
No, I don't get that from her at all.
All right, but her
she'd be much more angry and jealous and envious.
I don't know.
Much more self-righteous. She'd be like, how dare they?
Female coach, basketball, volleyball?
No, I think they're at the same school. She's worrying about her friend. They've known each other since they were kids. This isn't
I'm the only person that she's told. And
for me, this is one of my pet peeves. I think that's an egregious violation of the relationship and the trust and the boundaries that physicians or teachers or therapists or government officials or presidents of companies, people in power over people beneath them, take extraordinary advantage of people beneath them. And
that's why you work so hard to get in that position. But
yeah,
Sarah,
I understand there are people that do that.
How old is this friend of yours?
She's not, she's 20.
And how old is the coach?
Over 40.
All right, but her coach is she's a tired lesbian who's hitting infield with a fungo bat all day, and she needs some love too. And she's a softball coach. It's not a professor or anything.
No.
For Christ's sake.
No, come on. It's still.
On top of which, her coach is in another relationship with another female who she's been in the relationship with for about 8 years.
Beautiful.
So. Everybody's cheating on everybody. And
was your friend lesbian before all this?
No.
This is a new thing, lesbianism.
Yes.
Yeah.
And if you ask her what her sexuality is, she says that she's straight.
Has she always been confused? Did she have a pretty traumatic past?
No, actually, she's lived a very normal lifestyle. She's very well off, comes from a good Catholic family, and, nothing has happened to her.
Okay, well, can you talk to her?
I tell her she's stupid.
Yeah, well, that's probably why she doesn't like talking to you.
Well, she's just being taken advantage of.
And Sarah,
it's not healthy for her.
That doesn't sound like you two are that tight. Anyway, why don't you just let it go? She's a 20-year-old woman. She's making some decisions. They may not be the best, but they're probably not going to kill her. And what the hell do you care? You guys have drifted apart.
And I'm more concerned about this woman who's taking advantage of her students. That's a serious issue to me.
All right. Well, maybe
you may want to, you may feel an obligation to report it too.
Here's my one question about softball at the collegiate level and professional level for ladies. What's up with the visor? They don't wear a baseball hat. They wear that visor thing. And I think to myself, hey, here's your chance to really wear a baseball hat.
Yeah.
You're playing baseball, essentially. Women's softball uniform consists of shorts, which seems like a mistake because every time they slide, they skin their knees up, and a visor.
But they got more hair up there, right? You're going to put a cap on top of that?
Pull it through that little space in the back.
There's already more thickness. It's going to be hotter than hell with a hat on.
Hotter than hell. Baseball players have been wearing baseball hats for a million years. Yeah, why would you screw with that? They look like they work at a Wiener Schnitzel with that funky visor they wear. I don't understand the visor in women's softball. That's the first thing I would address.
Noted.
Then I might talk to the,
So first address the uniform code. Right. Then talk to the dean of students. Okay.
Right. That's priority.
All right. Noted.
All right. Veronica?
Hey.
You're 22.
I'm 22.
What's up?
Well, I just wanted to say to Dr. Bob, I have his book, and it's really good. And I bought it more because I was interested in prolonging my orgasms when I'm masturbating. And so you can use it, like, in that sense, not only
what made you
want to please your partner.
What made that occur to you? That you needed to what made it occur? Well,
I bought it because the title was so great.
But were you already looking for prolonging orgasm?
Yeah.
What made that occur to you? What was going on that made you think, gee, this should go longer?
Well, I was just getting there really quickly, and I wanted to slow it down and make it last longer and have, like, multiple orgasms.
And now, have you applied this with a partner?
No, I've kind of tried, but it doesn't always work out. It's it's hard to tell a partner you're doing this really wrong.
No, no. Guys appreciate that. I swear to God, guys. Wouldn't you say, Adam? I mean, it's how you do it, but guys want to be guided to the right.
Right. It's a kind of pin the tail on the donkey.
Right.
It's a cold, warm, burning. You're on the surface of the sun.
Yeah.
But it's not like, no, that's wrong.
Yeah, you suck. No. Yeah.
It's just like...
that's a good way to put it, Adam. We have that chapter...
Go to work for you guys.
That chapter we call the training cycle. It's kind of like pin the tail on the donkey. It's the way women give men information that's really more critical than so much what they're saying. You don't want to say, that's wrong, stupid. You want to acknowledge what he is doing that is good, and then say, honey, would you move a quarter inch to the left? And the guy says, hey, I can do that. And then he does, and you go, oh, that's so much better. We thrive on reward, on acknowledgement. We love it. If you learn to talk to the man, you can actually teach him how to actually do it better than you, because it's like tickling yourself. You can't really do that. No. And you can't really make yourself...
Unless you're super high, then you can do it. You ever do that, Trevor?
Tickle myself?
Yeah, it's fun. You get really high and you tickle yourself.
I never knew that.
Mushrooms I'm talking about.
The only way I can tickle myself is if I take my tongue and rub it along the roof of my mouth. Or sometimes when Drew rubs his tongue on the roof of my mouth, I get that same sensation.
But
I just made myself laugh.
The problem we have is
I'm
that
doing it now, Drew.
These women wait, they're so frustrated, so angry by the time they start talking about it that all pours out on the guy.
Right. They have been sitting around for a year and a half in a relationship, getting frustrated, faking an orgasm, not giving the guy any input. The guy has been floating further and further from the dock. They get more and more angry, and then it just comes flying out after a half bottle of Chardonnay, and the guy freaks out. This is what guys do all the time. Where'd this come from? Where's this? I always love it. I love it when a chick breaks up with a guy. Like I've had this happen where you just come home and they've packed up and moved out. Yeah. And the guy's talking to his buddy. He's like, what happened to shit? Well, bitch freaked out. I don't know. It was great. Everything was great. It was great. I swear to Christ. I said bye. I gave her a kiss. I went to work. I came home. She was gone. I have no idea. And you talk to the chick, and the chick's like, oh, this has been coming for a year now, more than a year. And I've been, and 6 months ago, I gave him 6 months, and the guy's totally blindsided because we're a little thick that way. We don't sweat those details in life, ladies.
A little thick.
Yeah.
Completely clueless would be more accurate.
It is sort of your job to...
That's unfair, but it's true.
It's reality, so let's just get used to it and move on. All right. Dr. Bob Schwartz is our guest tonight. He is don't go anywhere, Drew. He is the author of the nation's foremost... All right, but Drew, let's just wait till we go to break.
I will wait for you, don't worry.
Thank you. Foremost sex therapist and educator, The 1 Hour Orgasm is the name of his book, and we'll be back with more of your questions after this.
This is Rodney Dangerfield. I'll tell you, the guys here at Loveline are the greatest. They're the best in the whole world. Now, will you please untie me?
Yeah. Life's interesting. I'll tell you a few things before 1-800-LOVE-191. A couple of things. Dr. Bob Schwartz is our guest tonight. He is the author of The 1 Hour Orgasm, which can be found at the bookstores as we speak. Two things I was going to say. Yeah. One, I was listening to some very boring AM talk radio as I drove in tonight about 9:45. I think it was Ira Fistel I was listening to. And I hope no one in our audience knows that name. And somebody called in and was just talking about names and was talking about how Arnold Schwarzenegger and Schwartz meant black. in German.
Yeah.
And I was just listening, and it really caught my interest. I was really fascinated. I don't know why. I was just listening. I was going, and I remember like thinking about Schwartz and black, what the? And I was talking about the guys I knew named Schwartz and why. And I knew a sex doctor was coming in tonight, but I hadn't, as usual, not done my research at all. And it turned out to be Bob Schwartz. And so there's a Schwartz payoff 10 minutes later. And earlier tonight, I was at the American Comedy Awards, and Paul Verkaman from CNN, our friend, our entertainment reporter friend from CNN, was talking to me, and he said, still the worst guest, Rodney? And I said, what do you mean, Rodney? And he said, I said, who are you talking about? I said, Rodney Dangerfield. He said that was your worst guess. And I said, yes, you are so right. And an hour and a half later, there's the Rodney Dangerfield drop.
Which we haven't heard.
How you doing?
Haven't heard in
look at your hair.
Which we haven't heard in 2 years.
It's not crazy, incredible, write a book about it kind of stuff. It's just those weird little connections in life. Two things sort of prominent in my in the last 2 hours of the evening come right to me as I sit here at Loveline. All right, let's talk to Pablo, who's 15. Pablo?
Hey, first of all, just a message to all the children of America. Whether you're motorcycling, shooting some hoops, or masturbating, use Man Show deodorant.
Oh, yeah, hey, thank you. Thank you, 110%. Hey, he's just quoting a little Man Show bit.
All right.
Yeah, Man Show deodorant.
Next? Yeah.
Specifically designed for the chronic masturbator.
Nice.
Thank you.
Pablo?
All right.
You got something a little more
yeah,
to the point?
All right, here's the deal. 4 days ago, the area between my testicles and my anus started to leak this kind of pus that smells like blood.
Mm-hmm.
You mean you have a wound there? Or something was coming out of your anus?
No, it's a wound, like the area is red and inflamed, but I'm not quite sure what it is.
You can have lymphatic drainage from that area, and you can have pus, so you can get infection. I mean, maybe you can't see what's there. Maybe there's an infection, a boil or something.
Because I know, like, it's like kind of red and raw, like almost like a.
Yeah, but there's probably something more in there, and it's probably draining out of whatever abscess cavity.
That's where your body's stuffing seam is.
Yes.
I mean, I'm no doctor.
And be careful if the seam stops opening, the whole thing will unravel, and you.
I'm not saying your bowels will fall out from underneath you, but there's a seam in men that goes from the bottom base of the penis, right? Basically, the front top of the testicles, down around the bottom of the testicles, and follows along the contour to the anus. And that's like, to me, that's, if you were a pillow, that's where you would have been stuck. I don't know what that is. Why do we need that there? Why do we need that seam joint there? It's nowhere else on your body, that seam.
Yeah.
It runs right to, and it's down the middle.
You know
of
why?
it.
Because that's we start out with labia, and that's where they fold together and seal.
Grow together, yeah.
Nice.
So
that little seam once in a while can get a little irritated down there. Yeah?
Too much information, Adam.
Oh, yeah. I mean, not on me, but I've read studies. Oh, yeah. Yeah, a little seam. So that's where your labia was, huh?
That's where your labia. You may still, you coax that apart. You may have a vagina there.
Ooh.
Yeah. Good time.
Go digging for that tonight when I get home. Get out that big wooden spoon and see if I can't find the inner vagina. Ron?
Hi.
You're 26. What's up?
Yeah, I'm just concerned that I'm not satisfying my wife because I've been with her for almost 4 years now, and I don't last very long.
Yeah. How long do you last?
Oh, there's times where I'll last maybe 2 minutes, but most of the time I last just like seconds.
No, that's not nice. And it's always been this way in the relationship?
Pretty much.
All right. Dr. Bob, what do you think?
Well, two ways to handle it. One is to learn how to gratify her first, and then it doesn't really matter how long it takes you.
This is the basic technique we adhere to here at Loveline.
Yeah, I even distill it down more, which is just go down on her, because the clock starts when you get down there. Takes you 30 seconds to orgasm. You stay down there for 15 minutes. You made it almost 16 minutes.
But still, I find in my research that most guys don't know what they're really doing when they get down there.
Aha.
So,
yeah, well, let's talk about some techniques when you're down there performing oral sex?
Well, first of all, there are 3 steps, basically. One, you want to know where those nerve endings are. You want to know where the clitoris is.
Which I think most guys don't know. They really don't know.
And even if they do know where it is, they don't know exactly where on the clitoris the most nerve endings are located.
Ooh, see, I'm like most guys in that I don't know where the clitoris is, but I do a sort of carpet bombing technique, you know. It's not the smart bomb. I just take out the whole goddamn city with my tongue.
That's nice.
Yeah. Go ahead, look at it. I figure we'll get them all. Yeah.
I've always satisfy her first, but I just wonder, I don't know if she wants to have that for longer or what.
And this is for Adam's sake.
I don't want to look at that, no. And Drew just got out the anatomy book. And Dr. Bob, even on the clitoris, or the clitoris, as we like to call it here, where are most of the nerve endings?
Most women will argue with you and tell you it's on their right side. Oh. And the reason is most women are right-handed, so that's the side that's gotten the most exercise and it's the most developed.
So they also dress to one side or the other, just like a man.
With their... No, of course
but
not.
If you're a guy...
Adam,
since when do you have a sense of humor?
But if you're a guy and you're looking right at her genital area, looking at the clitoris, and imagine it's a clock. At 1 o'clock, there's a little hood, and if you push it back very, very gently, there's a little ridge, a little ridge underneath it.
Well, wait a minute. 1 o'clock is to her left.
Yeah, it'll be her left.
Well, you just told us the right side.
Well, that's her right side is the most, she feels is the most sensitive.
I know, but why are we working toward 1? We should be working toward 11.
I'm telling the guy from his point of view, she'll think he'll think it's on
1 o'clock
from his at 11 o'clock from his point of view, but it's actually at 1 o'clock from his point of vue.
All right, wait a minute. Now
she's looking at the clock upside down. So
well, she doesn't get to look at a clock. Her vagina has just become a clock.
No, her clitoris.
I mean, no. Okay, but let's make the vagina clock for a second.
All right.
Okay, I'll be the little hand. Not the big one. Now, you're looking at the vagina clock.
Right.
You want to go to 1 o'clock or you want to go to 11 o'clock?
You're going to be way off because, see, the clitoris is up higher and a lot smaller. And
Well, let's call the clitoris 12 midnight.
Yeah, okay.
It's called the hook you're hanging the clock from.
Okay.
Yeah, you've got to get real tiny here, because if you've got to go up and move your clock to her clitoris because it's so small, and there's so many very tiny distinctions there, that if you're using the vagina clock, it's like you can't even see it. You can't even see it move before you get to the right place.
Are you questioning the vagina clock?
No, I think this way he's described is very important, because we should be looking at this tiny little area that's basically the size of my pinky finger.
Is its own clock, like a chronometer?
Yes.
The landscape of the moon.
Yeah,
you understand what I'm saying? It's a sea of tranquility in there.
It's big. I mean,
lots
look at it.
Lots of different things we got to figure out here.
All right. But still, I want to stick with the clock here so we can find our way around the vagina. Let's put the vagina on the face of a clock. Okay. And let's make midnight the clitoris.
That's the clitoris, right? Or clitoris.
Is the idea to work toward 1 o'clock if you're, that side of the clitoris, or the 11 o'clock side?
The best way with the vagina clock is to find the clitoris at 12 o'clock. Then once you find it, make it a tiny clock inside the clock.
Right.
And look for 1 o'clock on the clitoris.
Okay, but we're saying the same thing. You're saying just go just one click to the right. 12 midnight.
From your point of view as a guy.
Sure.
Yeah, okay. And then there's a little hood there, and you push it back, and there's a little ridge right underneath it. And if you aim for that place, that's where you can actually give her the most intense sensations for the longest period of time.
You understand, my tongue is a big, bulbous, fleshy thing. It's not the end of a number 2 pencil.
But most women talk about using the flat part of the tongue there.
Right.
And you can pull back with up further upstream.
I still do have I'm still confused as far as Dr. Bob goes, which is the left side. To me, that's still the left side of a woman as she's lying down. I thought you said the right side.
From your point of view, it's on the right side, right?
Okay, but you said most women are right-handed,
right? So
and the right side.
So
of the clitoris is more sensitive.
So 11 o'clock gets the most stimulation, or 9 to 11 gets the most stimulation with most women, because they exercise that part the most often by themselves.
So we should not then focus on that part.
They'll just, at first, they may think that's the most sensitive place. Mm-hmm. But if you train this 1 o'clock place, it will become her favorite spot.
I see. Mm-hmm. Okay.
But to answer his question, and I'm glad you're already satisfying her first, you want to last longer. You want to be able to have her have orgasms through intercourse, which is every man's goal. That's really important to guys.
Right.
That means something.
Not to women, interestingly.
No, not to women, but to guys, that's so important. And in order to do that, you need to not only last longer, you got to make sure you're giving her enough direct stimulation. I've heard several sex experts say this before, that 70% of women can't have orgasms through intercourse without direct stimulation. Well, no woman can have orgasms without direct stimulation. Just like no guy could have orgasms without direct stimulation. But most guys think that the woman's most sensitive spot is deep inside her vaginal canal. I think this is from watching pornography. And they think that it's somewhere a little bit out of range. So if they go a little faster and harder, they'll eventually hit it.
That's the proverbial vagina on a stick.
But when we get back, we're going to talk about what you do.
Yeah, I'm not sure whether to get horny or not. My balls are confused. Yeah. I got to be honest with you.
For my sake, just settle down.
No?
Take a deep breath.
I'm thinking about it. All right.
Stay in the contemplative phase.
Dr. Bob Schwartz is here, the sex expert. We'll take a break. We'll be right back. Loveline. I'm Adam Carolla. That's Dr. Drew over there. Dr. Bob Schwartz is our guest tonight. He is the author of the 1 Hour Orgasm. Dr. Bob is the nation's foremost sex therapist and educator, and they've really gotten to the bottom of a couple of vaginas tonight.
He has a website, too.
Yeah, it's helpmedrbob.com.
One word.
Yeah, all one word.
Dr. Dr.
Dr. B-O-B, no periods. And we've got something free for all your listeners. I find out guys mostly aren't real romantic when it comes to after the honeymoon period. So we came out with a Venus Butterfly newsletter that we send out every Friday with 1 or 2 tips that we want you to just try out next weekend.
Here's what they got to do, is send out email on your behalf to your lover, very romantic musing.
Yeah,
there you go.
Yeah, cut out the middleman.
Yeah, just, we'll give you our signature, and you just...
we'll give you her work address or something. You send it right over there. Maybe some flowers.
And then she can do it to you. We set it up where either partner can actually initiate. And it's free to all your listeners for the next year if they just go to the website, please help me, Dr. Bob, and sign up for the newsletter.
All right. Drew, you don't want any help, though, do you?
As far as what?
Well, I mean, you and I, sexually, we're like some of the heroin addicts you see who aren't interested in quitting. You know what I mean? Like, we know it's bad, we know it's killing us, but sorry, we got a little more to go here. We're just not ready to quit.
What are you talking about?
With our just sort of lax, lazy sexual lifestyle.
No.
You want to get better sexually?
No, I already work at it. My problem.
You do?
Oh yeah.
Well, you know why? Very. Drew's a very passionate man. My problem is I can't seem to get the romantic thing right. Whatever, the needs for connection, communication, overwork. You're going to hump the bejesus out of somebody, but you just can't get the flowers, the rose petals, the trail leading to the top. And I really have good intentions about it. I just... You know why? Because you're like me. You start laughing in the middle of even thinking about it, right? Cringing. It feels... it's like the roof of the mouth. Yeah, it feels so corny and insincere. Yes. Like just like a bad Hallmark card. Yes. I feel like phony. Yeah.
Like insincere is a great word for it. But
it's like when you see these celebrities like Kathy Lee Gifford hawking something on late night TV, and you just cringe. Like you just go, oh man, how can they do that? I don't know why this just popped in my head.
And guys that really get into the giving the flowers and stuff, don't trust them. They're up to something.
I don't trust them either. That's a very good point.
My wife has a suggestion for you. She taught me. She told me after a while, she said, Bob, don't try to surprise me anymore. I always have to pretend I like it, and then that's a big strain. Here's what we're going to do from now on. I'm going to tell you exactly what I want you to do, and then I'm going to forget I told you, and I'm going to be so happy when you do it because it's going to be exactly what I want.
Okay, I'm going home. I'm asking. I want to write. I want directions. That's
right.
Seriously.
Drew, your wife's motto is she's not going to tell you anything and be pissed when you do nothing. Isn't that more her angle?
No, she tells me. I just don't seem to get it right.
Yeah.
Or I can't keep it up sufficiently.
I got no energy. I can't. Like I said, I don't know. There's a few things in life that just make me cringe, and that rose petals to the tub with the candles around it just does it to me. It just feels like flat out BS. I know, because I'm so uninterested in doing it. I really am. It has nothing to do. I'm only doing it for them, and maybe that's what they want, but it just doesn't feel right. It's really, you know what it's like? It's like going to a funeral of some guy you don't know and didn't like, and making yourself cry.
And eulogizing.
Yeah, and rubbing an onion on your face, and you can bring some tears up. All right. Oh, boy, Drew.
We're
can't wait for Valentine's Day.
Well, no, that's why I stress about Valentine's Day, because I can't get it right. I want to do it right. I want to.
Yeah, and your wife's.
I'm stressing about Mother's Day now.
Oh, really?
Yeah.
Oh, you got to do something with your wife, yeah? Mm. What is that? Shouldn't everyone just take care of their own mom for Mother's Day?
I've got little kids that have to take care of that.
So you got to go buy your wife presents and then sign the kids' names on it?
They'll do it, but I have to go out and figure out what that something should be. And I'm so lame.
But couldn't you just really give the kids $40, tell them to go get their own crap? I mean, think how sincere that would be.
Yeah, I did that last year. They bought
Come back with some Nintendo.
No, they...
There you go, Ma. Boy. Enjoy. Hey, Ma, you done with that? Thank you. We'll be in the den. All right. Kara?
Yeah?
You're 15.
Uh-huh.
What's up?
My breast size is, like, really lopsided. I have, like, a B cup, and one's, like, a C cup.
That's very common, and you're still 15. There may be some equalizing, so to have different symmetry, to have the nipples pointing in different directions, to have different sizes, very, very common. And if after the age of 18 or so you're still troubled by this, there are plenty of plastic surgeons out there that are ready to help you.
Can I get one reduced?
It depends on. Usually, I think they build up one more than reduce one.
Really?
Yeah.
Well, I guess it depends where you're at. I mean, if one's an A and the other's a B, they'd probably build it.
But again, that'd be a question for a plastic surgeon.
All right. Kara? Mm-hmm. You're 15.
Don't worry about it right now.
I know at 15 it's hard not to worry about anything that has to do with your physicality, but don't worry about it. We get this call all the time. People seem to even out. Okay?
Okay. And Adam?
Yeah.
You have, surpassed Fred Durst on my notebook.
Oh, my God.
Number one.
Are you... Wait.
Writing my name on your notebook, huh?
Kara, is he on your shoes?
Yes.
Ooh. That's great. That is huge. That is huge. Dr. Bob, it has always been my dream to have kids write my name on their shoes. On the side of the vans there, that white stripe.
It's really quite gratifying to be working with a man that has achieved his lifelong dream.
Yeah, that and a peachy folder.
Yeah, he's been so much happier and fulfilled ever since the first call such as that came through.
I can rest finally. Yeah. Angie?
Hi. How
you
doing?
You're 42. What's up?
Adam, Dr. Drew, I love you guys.
Thanks.
I listen to you guys every night. Hey, I have a question. I have a huge clitoris, and I'm very horny every day of my life. I just want to know, is this normal? I'm very stimulated every day.
Hey, Angie?
Which part? The huge clitoris or being horny every day?
Both.
I think you're just a highly temes woman, which is every man's dream.
I know I'm Greek, but I don't know if that has anything to do with it.
No, and the large clitoris, women have different size just like men have different sizes.
Right.
But it doesn't make any difference as far as feeling. You have the same number of nerve endings that every other woman has. You make it easier on guys to find your clitoris.
Yeah.
Some women, they're so tiny that guys really have to squint to see them.
Again, the carpet bombing. I have what I look at as a large clitoris, too, down there.
Oh, yeah.
At least that's how you make yourself feel better, by describing it that way.
Well, that way it can be big.
Adam, you're too funny.
Yeah. So, hey, how big is your clitoris?
I don't know. I've never measured it. It's just really good
Put
size.
that on a card, please.
Well,
I know a lot of the men always make comments about it, and they really like it.
Well, what would average would be?
Stimulated, though.
Settle down. Average would be, let's say, size of a pea. Would that be about right?
Fingernail.
Thank you.
That seems a little. Dr. Bob?
Probably the first notch on the finger.
We've actually measured them to see the difference, but we were mostly interested in the difference between them when they were unaroused and when they were excited, because a woman's clitoris is like a man's penis. In fact, when she gets turned on, it extends.
Right.
And it goes, instead of up, it goes down toward her vaginal opening.
Right, because when I get stimulated, mine gets huge.
Yeah, and that's, you probably orgasm pretty easily through intercourse, don't you?
No, I don't, as a matter of fact. This is another thing I wanted to
Well, hold on, Angie. Calm down over there. Would you just relax for a second?
Okay.
I want to know about what size an average clitoris is. You measured them, didn't you?
I have? No.
Well, hold on a second. Angie's like too insane. I got to put her on hold for a second. I said the size of a pea. Now, to me, that's the sort of maybe bulb at the end, like what would be the head of the male penis, I guess. But the clitoris is what shape? Is it finger shaped, or is it
like
sort of bulbous shaped?
Like a penis.
Like
it
a
has
penis.
a shaft with a little shiny head on it.
Right.
No hole in it.
And the shaft is how long, approximately? Jesus, you're the vagina doctor.
About
half an inch,
a fingernail. Yeah, long.
3/8 of an inch.
Yeah,
and around just like your pinky finger.
I know, smaller.
Yeah, that's what I would assume. Yeah. Okay, I'm just trying to get a bearing here.
Smaller than most pens.
Number 2 pencil.
Yeah.
Okay, the eraser part of a number 2 pencil.
Right.
Okay. That's a good reference. Now, this is going to take about day and a half, so everyone hang tight, and buckle in. Angie?
Yes.
How big is your clitoris, let's say, and just give us a rough estimate when you're aroused?
Probably the first notch on my first finger.
On your index finger?
Right.
So it's like a long grape, let's say.
So about twice the size of a fingernail.
Right.
Did this suddenly enlarge, or has it been this way ever since puberty?
It's been this way ever since, for years,
Since puberty?
Uh-huh.
And do you ever take any medications?
No.
Nothing?
No.
You ever had any medical problems?
No dope, nothing.
Okay.
No drinking, no drugs, nothing.
No, I'm not going down that path. I wonder if you ever took steroids or anything like that.
And but yet you can't have an orgasm readily through.
No, I can't. No, just orally I can.
Right.
I seem to only go for men that are really well endowed.
I see.
And that works for you?
Yeah, that's the only thing.
Is it the sensation or the visual part of it?
Sensation.
Mm-hmm.
And I just want to
Sorry, Adam.
normal.
Yeah, I'm angry now. Very hostile. And how do you know when a guy has a big penis?
How do I know?
How do you know?
No, I mean before you see his penis.
How do you know that's somebody you want to date?
Well, I don't know. I've been with a few before that were really small, and they never heard from me again. I really lose interest. I go for well-endowed men.
Hey, Angie, what's going on in the background there, goofball?
I'm playing my poker video machine.
Okay. All right.
So
I'm going to hang up.
Normal then? I'm not a freak?
You're not a freak.
Yeah, you are kind of a freak, but I'm going to hang up on you.
Not for the reasons you're concerned about.
You're playing the goddamn video poker while you're talking on a national radio show. You can't set the thing down. And listen, Angie was a nut job. And I don't know why this is. And I hope Dr. Bob doesn't take any offense with this, but women especially. Not all men, but most women who are really sort of obsessed sexually, you scratch beneath the surface a little, and there's nut job right there. And I don't know why that is. And it's a little bit of a curse, and as a society, we wish there were women who were just horny like guys and who enjoyed a big penis, and what's wrong with that? But you know Angie's a handful and a nut job, right?
Yeah.
All right. All right. Isabella?
Yeah.
You're 16?
Yeah.
What's up?
Well, lately I've been having trouble, like, orgasming. And if I do, it's, like, really bad. And I don't know what's wrong.
What do you mean bad?
Like,
unsatisfying.
It's like a really, crappy one. It just doesn't make me happy.
How do you know you're having it if it's a really crappy one?
You'll come to experience this kind as you get older.
I will? Well, personally?
Personally.
Well, I know.
Aging men get that.
Yeah, I've had that, like, I got a 12-pack in me. I'm going to beat one out before I hit the hay. Penis flopping all over the place. Don't even remember it the next day.
It's not so much that it's unsatisfying. You feel guilt and disgust when you do it, Adam. That's the problem.
Huh?
Okay.
Isabella?
Yeah.
Yeah. You got a boyfriend?
Yeah. But he lives far away, so.
Well, are you on any medication?
No.
You sure?
Yeah, why?
Birth control pill?
No.
Nothing.
I don't see him that much, so.
We're wondering why suddenly this became a problem.
Well, what do you mean?
Well, it's a recent problem, right? That the orgasms become less.
Well, it's been like a month or two now.
Have you been depressed?
Kinda, yeah.
Are you sleeping okay?
Yeah.
If you're a woman and you're depressed, you're either going to have horrible orgasms or just crazy, insane orgasms. But neither one will be organic. Yeah. So, Isabella, how often do you see your guy?
Once or twice a month.
How far away does he live?
4 hours.
I see. How old is he?
He's 19.
16? Calling from Bakersfield?
Ooh.
I haven't spoken to anyone from Bakersfield that wasn't depressed, by the way.
Yeah.
Not one. They're all miserable over there.
Yeah, it's a crappy town.
Yeah, everyone hates it. The mayor of Bakersfield, I interviewed him last week, told me the town sucked. The guy from the Rotary Club in Bakersfield said the town was a piece of ass. Everyone hates that town. Listen, get out of there.
Are you sure you're not on any supplements or anything that might be affecting you biologically?
No.
Nothing.
I used to have, like, really good ones, and it's like I can't now. It's really hard.
Well, why don't you focus on your depression and
what
forget about your orgasms?
Yeah, what has changed in this last month for you?
Nothing.
Any chance you're pregnant?
No.
Okay.
I got my period, like, a week ago.
Isabella.
Yeah.
Let me give you a couple good words of advice. Okay. You will get pregnant eventually without using birth control.
Well, I use a condom. So.
All right, but I smell it on you. I smell pregnancy trouble.
Keep the emergency contraception around if you're just using condom.
All right. And then get your grades up, do well in school, and go to some college far away from Bakersfield, all right?
Okay.
Meanwhile, just replace orgasm with depression and focus on that. Because I guarantee you when you're in a better way, emotionally, the orgasms will be better.
All right.
All right. Good times there, baby.
Bye.
Drew, you disagree with that?
No, I'm with you.
Jesus Christ. Someone's going to come from Bakersfield and try to kill me, right? I mean, eventually.
No, they're too depressed. Come on.
I really just don't think there's enough gas in the pickup truck to make it out to L.A. Why are people living in Bakersfield? What the hell's going on over there? Listen, I want to say this. I was talking to Dr. Bob, who I think I may have been yelling at for living in some part of Houston or something before the show. All you people who live in horrible, horrible places, move. Just go ahead and move. Don't move to L.A., but move. You don't know it. You're right in the middle of that horrible, infested swamp, and you don't know it. Listen, you're talking to a guy who spent his whole life in North Hollywood. Took me quite a while to realize what a dump that place was. You pick up and move. It's better for you. It really is.
Why you bought property in North Hollywood again?
And here's how dare you?
Understand that.
I give back to the community. That's why. I'm interested in an outreach program I call Build a Huge Goddamn Fence and have everyone leave me alone.
And then have loud, crazy parties.
I'm trying to work on a catchy acronym for it, but I haven't worked it out. But the irony is you people who live in these crappy towns have crappy jobs. You can get a crappy job anywhere. Go to San Francisco, get a crappy job. It pays the same. Ariel?
Yeah?
You're 26?
Yeah.
What's up?
Okay, I've been having anal sex with my fiance It's just sort of been recent, and he has been ejaculating in, and I haven't had any problems with that, but I just have been wondering if problems can occur.
He's been ejaculating in you? Did you say?
During anal sex, yes.
Well, one of the problems that we've heard about on this show is that you can actually impregnate a stool. That you actually can...
Grows into a giant stool sometimes.
Yes, baby stoolie. And, boy, it's a mess. Because when they go number 2, look out. That is bad times. Yeah. Hey, so you want to know if there's a problem with that?
A number of these run around Bakersfield.
I'm just wondering if there's any
There we go. Well, first of all,
problems with it, or
is this your little tricky way to sustain virginity?
No.
Huh?
No. No, it's just I like both. I like
All right.
both
Well,
places.
it's aside from potentially causing anal pathology like hemorrhoids and tears and fissures and harming yourself, which can happen. It's the most efficient way to contract a sexually transmitted disease if there's any risk of that kind of thing going on here.
Okay, there's no risk, I know that, but I was just curious if there's like any side effects, or if it's just bad for that to happen, or...
I'm not sure. I just mentioned a list of things that can go wrong. What more?
But is she talking specifically about the ejaculating in that area?
Yeah,
No, there's nothing special about that other than infective problems with infection.
All right.
Okay.
Dr. Bob, you go down this road much? The anal sex road?
Road less traveled?
No, not a part of your practice, something you study in the Institute or anything like
poop
that.
is not a part of his practice, Adam.
Yeah, well, there are a lot of women who claim that that's something that really stimulates them.
Yeah.
And, if
do you guys study that at all? I mean, who is it that goes after that? Because we have a certain subset of women who a certain group does that because the guys these days are pressuring a lot more for that. There's some sort of an aggression that they're acting out, that they really are into that, or maybe pornography has made it more of a romantic idea.
Well, I think generally the stakes have been upped. The ante has been upped.
The young people, this is the direction they're going. And then some young women claim that it's especially arousing for them. Is there anything about those people? Anything?
I think it's just because it's forbidden.
Taboo.
Erotic means that you're doing something sort of outside the rules. And the more rules there are to break, the more erotic
and yet
you can
most
be.
of them are doing that as a way of sustaining rules. Like they're gonna, I'm a virgin because I'm having
Yes, right.
And so it's like, it's not forbidden. It's like no big deal.
Hold on, Drew. That's an outlandish statement. Not most of them.
No. If I said that, I misspoke. But we talk to a lot of those.
Yeah, we like to kid about that, but it's really a pretty small percentage of people who engage in anal sex are doing it to keep their virginity. I would say out of all, if you took a poll of all the cornholers, and this is why I would make a great scientist over at your
and
institute.
Politician, yes.
Right. I would say that it'd be less than 10% that was doing it to keep their virginity.
I would agree with that. Right. But that's becoming a big number now, though.
All right, well,
anal sex.
Drew, please. We didn't get to break yet.
Oh, sorry.
Dr. Bob Schwartz is here, the sex expert. He's the author of the 1 Hour Orgasm, and I may come out with a pamphlet called the 45-Second Jack-Off. Maybe I could put that sort of a supplement in your book. We'll work that out. We'll take ourselves a little break. We'll be back. It's Loveline. I'm Adam Carolla. That's Dr. Drew over there. Phone number 1-800-LOVE-191. Nicole Sullivan, the beautiful blonde from Mad TV, is going to be in here tomorrow night. Dr. Bob Schwartz is our guest tonight. He's the author of the 1 Hour Orgasm.
Website?
Go ahead, Dr. Bob.
HelpMeDrBob.com. The things that we found lately, though, with our new videos is that of course, that most men don't like to read, and they like shortcuts. They like things that are easy and fun.
Yep. We're trying to get this show down to an hour and 40 minutes. We haven't figured that out yet. Still working, though.
But what we did is we got some very attractive couples to volunteer to let us film them while we
Adam's in.
Yeah. It's called pornography, Dr.
Well, no,
I don't know if you've heard about that.
No, we were teaching them the Venus butterfly technique, the 1 hour orgasm technique for the first time. And it's useful because you see the mistakes that most people make when they're learning something new, and then what happens when you correct them and they're doing it right. And women have told me that they tried this technique. A lot of times their guys aren't, like you say, lazy, and they can't seem to motivate them to do anything new or different. But one woman came up with something, and we've been using it lately, that she ordered the video. It's called For His Eyes Only, How to Make Sex More Fun for Her. And she told him at work that to come home and be hungry. And she met him at the door. She shoved his favorite drink in his hand. She led him into the living room. She sat him down in the chair, put his favorite meal in front of him, pushed the button on the VCR, which I think was the most important thing that she did. She walked out of the room and said, "I'll be back in an hour." Mm-hmm. And at the end of an hour, she came back in and she took him by the hand and she led him into the bedroom and she says, "I want you to show me what you just learned." And guys love to show off when they learn something new.
Right. So if you make it into a competition or a test, they'll perk up.
Exactly. And when they see other guys do it and they say, "Wow, I didn't know that could be done," and they want to try it out on her for the first time. So the videos actually work so much better than the book. The book's good, but it's just for guys, we just don't like to spend that much time reading and figuring stuff out like that. But you show us how to do something. It's kind of like that tool man kind of thing, you know.
Well, I'll tell you a couple of things. I know because Drew and I are both horribly unmotivated. Many facets of life. First thing I was thinking about during the commercial is Drew. Here's how you know we're bad. Dr. Bob bring in 2 tins of chocolate to give to our ladies during their tumescent period. We polished off the first one. All right? We're going to get to Drew's tin in a couple of minutes. Drew, you'll probably eat that tin on the way home, right?
Oh, yeah.
So you know you got a serious problem when the doctor presents 2 decorative tins of chocolates and says, "Give this to your ladies." And we go, yeah, sure, Bob. We immediately dig into it, and we've damn near finished off the first tin. That's all you need to know. Is that
that's it.
Enough said?
That's us.
That's us. And I'll tell you how I like to look at myself sexually, Dr. Bob, and here's my problem. I look at myself as a fat, lazy heavyweight with a good right cross, which is, this is what happens to guys. They don't train too hard. Yeah. They don't put in the road work. They don't put, you know why? Because they know they got a big cross on them. And they know they still got some knockout power, and I just bring that into the bedroom. I'm like, I don't need any of that crap. I don't need any. No jumping rope, no sit-ups. I'll take this guy out.
And instead of using your right upper extremity, you're using your tongue.
That's right. Yeah. Knockout tongue. Yeah. Thank you.
Well said.
Forrest?
Yes.
You're 23. What's up?
Well, I'm calling from Orange County, California. And what's up, Mayonnaise? Dr. Drew.
Thank you.
What's up?
This is my main mayonnaise.
Yeah. My question is regarding G-spot orgasms and multiple orgasms. Is there scientific evidence that would show it's totally reliant upon the woman's anatomy, or is there certain techniques that can actually be done to attain these types of orgasms?
Most guys are confused about the woman's G-spot because they think it works like a garage door opener. You don't just push on it and suddenly she goes into tremendous orgasm. She has to be turned on first. It's like the man's G-spot. Unless he's already turned on, when you press on it, it's not going to feel good at all. It's going to feel, to her, it feels like you're pressing on her bladder trying to make her urinate when she doesn't want to.
Where is that G-spot?
On the woman, it's at 12 o'clock, up inside the vaginal. We'll use the vaginal clock.
It's in the next room behind
in the next
clock,
room,
right?
about an inch and a half or 3 inches inside, and you can actually feel this tiny little wrinkled nickel imprint on the roof of her vagina if she's lying on her back.
I mean, if you put your finger into the woman and you make a sort of hook shape with your finger, you'll find the G-spot up there.
Right. And if you get her into this state of orgasm and then you begin to stimulate it, it works kind of like a turbocharger on a car, like a passing gear. It kicks her into a higher speed.
Talking out of language.
Nice, nice, running off.
Gotta put some vents on there, keep it cool.
Using the woman's own exhaust to propel the impeller to then force
what's more fun is the man's G-spot, because if the woman learns how to actually do this 1 hour orgasm technique to the man, and she stimulates his G-spot at the same time, she can accomplish something that is unbelievable. She can add 1 to 3 inches to his normal size. Because that
1 to 3 inches.
You see, when we guys look down at him, we're fully erect. We only see about half our equipment. The other half is the root.
Yeah.
And
really? Yeah.
And down there, the perineum, which some guys call the taint, is the access to the man's G-spot. And if she actually stimulates this at the same time she's doing the Venus butterfly technique to him, that root, that hidden treasure, gets excited. It swells up and it pushes everything out further.
Underneath the scrotum.
Yes. No, between the scrotum and the anus.
Right.
No
That's
man's
underneath
land.
the scrotum.
You got it.
All right. And we call that the border between Scrotumberg and Anusville.
Yes, that border.
Right on that border.
Where your vagina was.
And you're supposed to stop that crazy talk, would you, you idiot? Please, you're poisoning the young listeners. And you should massage that area in a little circular way. Pressure.
It's important that she go in the same direction that she's stroking his penis.
Stop saying her, because I'm going to do this to myself later on, so it's confusing. I should do what?
Yeah, you should go in the same direction, the same speed, the same pressure as your top hand is using.
I see. Okay, so if my left hand is going up and down, then my right hand should go up and down in that area too.
Yes. And if it's and then you're stimulating the whole penis, not only the part that's sticking out, but the root also.
Yeah.
And then when that really gets excited and swells up, it pushes everything out. And you can take a ruler, or maybe in your case, Adam, a yardstick into the bedroom, and it marks a lot, and mark it where you normally are, and then do. I don't know if you can do this to yourself. It's better if your partner does this to you.
Well, here's the way I've done it, and there's a couple of things I got to say. First off, because I used to be a contractor, what I do is I take a transit and I shoot an elevation of my penis, the top part of my penis. As I lie on the ground, I have a marker stick against the footboard of the bed, so I can tell definitively the length my penis grows. Number two, here's my problem with that stroke down there. I got hair down there. That's going to be like ice skating on the Everglades, basically. I'm going to have a tough time moving my head down.
You need a lubricant.
I see.
Yeah, in both areas would be better.
You're a dry guy, though.
Yeah, I'm dry up top. That's me.
Well, definitely recommend the lubricant in the lower area.
What does your life become?
Lube. Okay, so lube downstairs. Yeah. All right. Could you put together like a laminated cheat sheet for me? Would you? I emphasize laminated. You put something about wallet size, something I can peek at.
How about something just hang on the wall there?
Well, I can just tape it to the top of my foot.
Yeah.
I never have recommended this before, but you might watch the woman's video, for the one we call For Her Eyes Only, How to Make Sex More Fun for Him, because we actually demonstrated in there. I really told most guys, do not watch this video.
Yeah, but that all that does is make them want to watch it.
Well,
you understand?
Yeah, but they'll ruin the surprise. And it's not, for most guys, penises are kind of ugly. They don't really think that's, and also it can intimidate them if the other guy on the one on the screen seems to be bigger than they are.
Well, I look at I know the camera adds 10 pounds, so I do the math. I deduct 10 pounds from any penis I see on screen.
You have a clitoris anyways.
How dare you. Chet?
Yeah.
You're 27.
Yeah, just wondering, I like oral sex better than, normal sex, but yet it takes forever, up to a half hour or more.
Hold on, Drew, you want some more chocolate? All right.
All right. Half hour more for what?
For him to reach orgasm, right?
Yeah, it takes like a half hour or more, and it's like I just can't relax or I can't concentrate.
But you like it more, right?
Yeah, I totally like it more. I take that over sex any day.
But it takes you longer to orgasm that way.
Yeah, but I enjoy it more. So I just can't I don't know. I just can't relax. Or I don't know why.
Maybe you enjoy it more because it's prolonged, and that's the reason you have a better orgasm.
No, he just
likes kind of. Well, but I think I'm kind of afraid because she gets like neck cramps and or I don't know. It just takes longer and they get kind of. I'm quit maybe sometimes because it's taking too long.
But you just like the idea of the whole thing.
Oh, well, yeah, definitely.
And the sensation, yeah. I'm going to tell you how you can get more oral sex. There are 3 ways. Number 1 is drink pineapple juice.
Oh, yeah?
Yeah, changes the body fluid. Some women really
about
complain.
This, and we never got a good answer on it.
And especially if a guy eats asparagus or beer, women tell me that really makes the semen taste awful. But pineapple juice can sweeten it up.
Well, I'll tell you, we've now, I hate to jump in, but I just have to. I can't help it. We've now hit number 3 in the trilogy, which is all night I was eating asparagus, and I'm saying, I swear to Christ, at the American Comedy Awards, there's a big platter of asparagus in the back. I was eating it, and I was saying to my partner, Jimmy Kimmel, I love the smell of my urine when I eat asparagus. And he was saying, I don't like it. I don't like that. And I was just saying, and I just took a leak 20 minutes ago, and I was thinking, I love this asparagus urine smell. So I was on the asparagus thing at least 5 times tonight, by the way.
And it's hard to understand the physiology of how sugar can end up in the semen unless you're spilling sugar, unless you're diabetic and spilling sugar.
Huh.
Because we actually did a test on Loveline. We actually did a controlled study years ago.
I listened to that show. And I was not on the show, but I listened to it.
And we couldn't find any difference. They couldn't tell. They really couldn't tell who was.
But Drew, haven't we heard enough? I don't know what you would call it, anecdotal evidence from people who call in who claim there's something to it.
What we've heard is that they
heard a lot of people
can make it go from awful to bad.
I sure as hell believe that asparagus ain't going to be a good time.
Yeah, people on medication, people using alcohol, people complain bad.
Well, if you can make it bad, theoretically, couldn't you make it better? Not good, but better?
Yes. It's the sweet part that I'm having trouble with.
I see. I got it. Maybe it's the taste. Maybe it's the pineapple flavor. Yeah. I don't know. I'm not.
Okay, so
I'm not an expert in that area.
So we got pineapple.
But the second one is really the most important one. Most women complain about doing oral sex to men because they say once they start, they know that they've got to keep going until they finish, even after it stops being fun for them. So what I would recommend to you is insist. I know this is going to sound hard, but it's not as hard as it sounds. Insist that she stop the moment it stops being fun for her, because it's going to roll over into something else, like intercourse.
Oh yeah, intercourse. Right.
But a lot of guys, I'm not in this school that the guys prefer.
Well,
oral
because
sex.
you're very, very passionate man, Drew. But I like a BJ. I do. I like my hands free. I like to relax. It feels like a procedure's being performed on me.
You're going to love the Venus butterfly, because that's the third way when she learns simulated oral sex, when she can perform the Venus butterfly technique, and with your eyes closed, you won't know what she's doing to you. All you'll know is you're feeling the most intense sensations you've ever felt in your life, and she can make you orgasm pretty much any time she wants. When she's using this technique, she can speed it up or slow it down. I think with oral sex, two factors. She's not really in control of the sensations as well as she would be if she did this manually to you. And 2, you probably have this mental block because you wouldn't do that to somebody else. It's almost kind of like,
that's why I like it.
Yeah, well, yeah. And
no, I know what you're saying.
Yeah, it might be like you kind of feel bad for her, and that guilt is getting in the way of going through with it.
Chet, I would say the quick fix is to maybe get yourself halfway down the road by taking care of yourself and let her come in and mop up. So I like to call it. The fourth way to get a woman to perform oral on you is to actually put a tennis bracelet around your erect penis. They'll try to get at it with their teeth. It'll be great. All right, we're going to take ourselves a little break. Dr. Bob Schwartz is here. He is the author of 1 Hour Orgasm, and we'll be back. Loveline. I'm Adam Carolla. That is Dr. Drew. Dr. Bob Schwartz is our guest tonight. He's the author of the 1 Hour Orgasm. He's the nation's foremost sex therapist and educator. Drew and I were just talking during the break about what we hate about humanity.
Systems. We hate about
systems. And I had a great experience Friday night. And I'll tell you, when I get screwed by somebody, it is so precious to me because these are things I remember and stories I relate. It's worth more than whatever the item was. I was, and you know my love of the good folks that man the falafel stands and those breeds of cats. They're genuine, loving, great people. The folks that don't mix up the chicken and the rotisserie beef, they're just great folks. And I pulled into a place called Ed Wazir Falafel on the way home Friday night. And like I said, delightful individuals, those folks. And I said, hey, give me a falafel sandwich. And, they're great. They're delightful. Very ingratiating, warm people. Next, what do you want? And I said, give me a falafel. And then I looked in my wallet. I saw I had $2 in there. I thought, oh, Christ, $2 cash. And I said, wait a minute, you take credit cards? And he said, $6 minimum. And I said, oh, okay, all right. Well, I look up the falafel sandwich is $4.25. Just give me the falafel sandwich, charge me $6. I can't do that. Oh, I said, no, you misunderstand. Give me the falafel sandwich. Just charge me this. Minimum $6? Charge me the $6. That's fine. I'm in a hurry. No. And I thought, wow. The folks' love of saying no
so much.
It trumps everything else in their life, you know? Yeah. Even the extra $1.75. And so it's great. I had a woman next to me, a young lady who was sort of the Henry Kissinger of the place, and she said she was waiting in line too. She said, order a couple of baklava and pad it up. She had this sort of baklava for peace solution. And I said, I looked at her, I said, I know that makes sense, but I don't want to do that. Just give me the goddamn falafel and just charge me the minimum. No. I said, all right, well, I'll just leave. So I just left. But I thought, wow, that's a delightful businessman there. Woo! You're going to get rich with that attitude. That's great. Mike?
Yeah.
You're 20.
Hi, I would just like to know, why can't men have an orgasm or multiple orgasms or as long as a woman can?
How many partners you had?
One.
Yeah. This woman has multiple orgasms. Not all women do.
Okay.
Well, are you asking in general, or are you asking about your partner?
No, my partner's fine. I'm just asking in general.
Well, he's noticed how different she is than him.
Is your partner multi-orgasmic?
She does when we have sex. She has more than one.
Write that down, Adam.
Scratch that.
When she has sex, that's when she has the multiple orgasms.
Right.
Okay.
So when you guys are playing Connect 4 or Marzipan or something, Marjan or something like that, no.
No.
I see. Yeah, scratch pad.
Canasta may cause one or two, but
yeah, I just want to know.
Interesting.
They can have more than one in the matter of.
Some can. Some can. Yeah. Not all of them can.
I mean, not all. I mean, well,
right.
Okay, the majority.
No. You're with a uniquely talented woman.
Wow. Okay.
Okay. That's not the majority.
She's a keeper there, Mike.
Now, any woman can be actually trained to have multiple orgasms.
Hey, send them to orgasm camp. Sure.
Orgasm school, yeah. Or even orgasms that last for up to an hour. And men can too, but you got to get rid of one notion, and that is that it's the ejaculation that's the orgasm. Here's what I want you to do, a little experiment. Next time you have an orgasm, pay attention. I know it's hard because you kind of pass out a little bit during that time, but try to stay conscious and notice that you have these contractions. You know, they start in the distance and they're kind of small and they get closer and closer until they're right in your face and they're real intense.
Yeah.
But then after that comes the ejaculation, and the ejaculation, what it actually feels like is like I guess the best thing I could say is like you're urinating. It doesn't feel bad. It's just nothing to write home for about.
I understand what you're saying.
Okay, so if you want to have orgasms as a man that last up to an hour, what you do is you postpone that ejaculation phase. You just enjoy the orgasmic contractions, and you learn how to do two things. You learn how to intensify them so they're stronger than you've ever felt before, and you learn how to actually have more than one, or more than the 6 to 9 that most guys have.
Okay. The contractions.
Yeah. And if you want her to do this to you, the easiest way we teach this is in the video, because nobody's going to go to a class and do this, but we show her how to do this to you in the videos. And I got to say this before we leave, because all my people are standing by at the office. If you want to know about the videos or the book, they can call our toll-free number, because they'll talk to them right now.
Really, right now?
Can I give it out?
Yeah, go ahead.
Okay, it's 1-888-696-0471.
One more time.
888-696-0471. And there are 2 videos. There's one for him to watch, one for her to watch, and then, of course, the book, The 1 Hour Orgasm.
Let's take one more call and speak to Jesse, who's 20. Jesse?
Hey.
Hey.
Hey. My question is, I guess when I ejaculate, I don't have those 6 to 9 contractions. I basically just ejaculate, so I don't feel anything.
Just a big, like, boom, and that's it.
Yeah, so should I shoot myself, or what?
No, you're just, you are having them, you're just not really paying a lot of attention to them. And they may be small kind of contractions. And it's something Dr. Drew was talking about. When guys have this kind of real small contractions, like their orgasms aren't that powerful. And women do this sometimes too. And sometimes, as a guy, you'll have ones that are incredibly strong. They blow the top of your head off. And other times they're this little kind of squeak, just small. You're probably having the lower end kind, and they're so small you're not even acknowledging them.
Hey, Jesse and Bob, we got to go to break, but get that book.
Are you on medication, Jesse?
No, but the thing is, I do have a form of cerebral palsy. I don't know if
well, yes, that definitely can. Absolutely.
Hey, the contraction is there to push the ejaculate out of you?
Yeah.
I got a plan. I'm going to try this when I get home. If you could force just a little compressed air down your urethra and make it more difficult for that ejaculate to get up the urethra, I'm guessing that your muscles would compensate and make the contractions more powerful.
So this is a way of doing sets with your penis.
Right. It's like adding weight to it.
You'd explode.
With compressed air. Yeah. No, I'm not talking about 120 pounds. I'm talking about 85 pounds.
30 psi. Okay.
Yeah. All right, I'm going to try that when we get back. We'll be back. All right. I want to thank Dr. Bob Schwartz for coming in here and saying his piece. It was enlightening 2 hours. Bob.
Thank you, guys. That was a lot of fun. Thank you.
Yeah. Yeah, you go on a lot of boring radio shows.
Yeah, right? I do. And you got great listeners. That's super question.
You particularly appreciated the falafel story. That was the highlight of the night, Adam. That and your preoccupation with what you were going to do with yourself tonight.
Yeah, and what about my urine? My urine has asparagus
yes,
in
the
it.
trilogy tonight. Yes, of course.
The 1 Hour Orgasm, everybody. Go out, get this book. It's got nudie pictures in it, and it's really going to solve all your sexual problems.
Why don't you give the website and the phone number out one more time?
Yeah, the phone number 888-696-0471, and the website is www.helpmedrbob.com.
Thank you, Dr. Bob. And until next time, this is Adam Carolla for Dr. Drew saying mahalo.
Loveline. The opinions expressed on this show are not necessarily those of the staff, management, sponsors, or this station. The producer for Loveline is Ann Wilkins Ingold. Loveline is a presentation of Westwood One Entertainment.